Hello, my name's Hudson Garrett, and I'm going to be your facilitator for today's topic, which is the concept of infection control. This is being brought to you by the Kentucky Infection Prevention Training Group at Norton Healthcare, which is part of the Norton Infectious Diseases Institute. Today, I'm going to introduce you to this concept from the Centers for Disease Control and Prevention for Infection Control called Project First Line. Project First Line was really introduced recently, specifically to target frontline healthcare providers in a variety of different settings, whether in hospitals, skilled nursing facilities, ambulatory care, or any healthcare environment where care is delivered to patients. The whole focus of this program is specifically around infection prevention and control, as well as patient safety. Our quick agenda for today's introduction is to go through the concept of infection control, what it is, and how we're going to set up this overall program in our total of 15 total modules. We'll also review the primary goals for infection prevention and control and discuss how you can provide feedback and use these tools and resources in your own clinical practice. So the first question is, why in the world do we even do infection prevention and control? Well, infection control by nature is a proactive step. It can also be a reactive thing. Right? Our goal is to prevent the infection from ever being in the patient in the first place, right? We don't ever want that organism, whatever it is, that device-related infection to actually contract the infection and actually cause it in that particular patient. That being said, it does require a very, very rigorous approach with basic techniques like hand hygiene, disinfection of surfaces, appropriate use of personal protection equipment, as well as other things. The reason we do this is changed in the last few years, especially with the COVID-19 pandemic. We primarily did infection control originally for patient safety, and now that's evolved to also protect us as healthcare workers. Whether you're a nurse, a physician, it doesn't matter. We want to make sure that our healthcare team, all of the individuals that help deliver care, as well as our patients and families, are all going to be safe from the wrath of infections. So our first episode is really focused on the goal of infection control, right? This may differ, but depending upon which actual clinical setting you work in, but overall, it's really similar. We know that we're trying to reduce the incidence of patient infection. We want to make sure that healthcare workers don't contract infections occupationally. We can improve the patient's overall experience, as well as reduce cost. We know that those are all fundamental goals of an infection prevention and control program. There are going to be some topics that are going to come up over the next 15 modules. The CDC does also plan to add additional modules, which we'll make available as soon as they become available publicly. Next, you're going to see some discussion about the basic signs of viruses. We'll talk a little bit as well about bacteria in a later section. Then we'll be transitioning into some lessons learned from COVID-19, things like respiratory droplets, how these organisms can actually spread from environmental surfaces to people. How does COVID-19 actually spread? And then we'll be transitioning into some broader themes and topics, specifically infection control basics. What does that look like? The core practices of infection prevention and control. We'll talk about source control. We'll talk about the different aspects of personal protective equipment. How do we put it on? How do we remove it safely? Realizing that many instances we see self-inoculation where the healthcare worker becomes infected when removing their PPE. Then we'll transition into some more topics, such as hand hygiene. We'll talk about what does that need to look like in terms of crisis standards of care, especially during the pandemic. What does microbiology of these organisms look like, and how do we recognize risk? We'll talk about environmental cleaning and disinfection, standard and transmission-based precautions, as well as the needs for triage. There are a few things that you'll see that will be consistent themes in all of the modules from Project First Line. First and foremost is we want to reduce the incidence of healthcare-associated infection, but equally so, we want to make sure that all of our members of our healthcare team, you included, are going to be safe from the impacts of infections. They will reduce occupational risk to us. Certainly, they'll promote a better patient experience, reduce cost, improve the quality of care, save that length of stay that we desperately want to prevent. And this project is going to be evolving over time as CDC makes more tools and resources available. We'll be happy to share those with you as well. There are some future resource training options available here on both the CDC website. We also encourage you to check out the Norton Infectious Diseases Institute website as well. We'll make that available on our webpage. You can also follow them on social media, on Twitter, YouTube, as well as sign up for actual Project First Line emails. Those are available here. We hope you've enjoyed this introductory module, and we'll make additional tools and resources for infection control available over the next few weeks.